start out telling students, like, let's have some fun, right? Like, let's go into the system and let's look at your data. And I think sometimes when students first open up the Insight tool, it looks a little scary to them, right? So the first thing I always say is click around. You are not going to crash the system. You're not going to delete anything out of it. Click around to get comfortable with it. We want students to be comfortable, so then when we're not around, or they're not with their learning specialist, they're not with a faculty member, they can go in and pull out the data pieces that they need. So let's take a look, and we're going to walk through a little bit about what we click on, and from a learning specialist point of view, what we view as most important. What we do is we start by selecting the exam results tab, and then we look for comprehensive self-assessment. After that, we're going to go to exam take, and if we just want to isolate one exam, we might look for the latest one. So for step 1, that would be the comprehensive basic science self-assessment. And here is where you could look at one in isolation, or you can look at multiple forms at the same time. Now, we know from looking at this overall score report, this is where we notice that the reproductive and endocrine systems are together, and they are flagged as one of the content areas that needs a little attention. So when we're looking at this screen, the most important thing that we try to get across to students is that they can sort and filter. They can sort the columns and they can filter the data. When we look at sorting, they can sort any of these columns on the screen in ascending or descending order. So I tell them, like, play around, look for patterns within this. Within the sorting, what do you see? What do you notice? And then we talk about, which we're going to get more into this, what we notice as learning specialists. But for students, having them verbalize what they notice, even within sorting, is extremely helpful. The other thing you'll see on the right-hand side, we can filter. So we can filter by looking at correct questions or just incorrect questions, or all, which can sometimes be helpful. We can also filter by content topic, and I tell students, click that button and look at the content topics. Play around and see what happens to the data and what do you notice from those overarching content topics. And then we can get even more detailed by clicking on content description, and this is where they can see different organ systems and different parts of the exam that do align with that step 1 content outline. We notice from looking at the overall score report that repro and endocrine are together. And so this is where, in the past we kind of had to guess or, make an educated guess about which one might be low. And now we can actually see it. So when you click on content description, what we tell students is first to click off select all, so that way nothing is selected. And then from there, they can type in endocrine. They can start typing it, and they'll notice as they start typing, it will automatically begin to filter for them. Once they do that, they're gonna select endocrine. And this is where they'll be able to see, okay, how many endocrine questions were actually on this exam, and then how many did I get right, how many did I get wrong. From there, we can also see, were they actually struggling in foundational knowledge, or were they struggling within diagnosing? And that also allows us to help a student make a plan. Maybe the endocrine related questions were correct, so we're done with endocrine. Now we want to go over and we can look at female and male together, or we can isolate female and male separately. So these are some of the ways that we look into this data for step 1. There's also some really cool and unique ways that we can use this for step 2. And I think, Kristen, you do this a lot at Rutgers, using it with your students, don't you?
Yes, I love this feature, and I love that when we moved into step 2, and now because step 1 is pass-fail, students are very concerned about really trying to work on getting a strong score for step 2. So one of the things that we can do in the very similar way that Shavana clicked through the processes, same thing for step 2. You would start at the top, you would go to the exam results tab, the comprehensive self-assessment, but now this time, what we're gonna select under exam take is comprehensive clinical self-assessment. And let's say we selected form 10. So what we might do then, and again, for this particular student, we noticed that endocrine is one of the 3 flagged systems. What I like to do is once they've isolated endocrine, I then go back to that main box and I like them to sort by the physician task. So I think it becomes very clear if they're struggling with diagnosis or what is the next step versus whether it's a lab question. And I think that also provides a lot of insight into what to study next. Oftentimes, if one exam is not enough within a system, like Shavana had mentioned, I would go back up to the top and say, well, let's take the last 2 self-assessments. And now let's, again, sort for endocrine, and then within endocrine, let's sort by physician task and see, is it clearly been the same pattern across the 3 exams?